Welcome back to the channel. Today, we're diving into crucial health information that could save your life. We'll be discussing 8 key warning signs of cancer that you should never ignore. Remember, this video is for informational purposes only and is not a substitute for professional medical advice. Let's get started and empower ourselves with knowledge. Have you noticed your clothes fitting looser recently, even without hitting the gym or changing your diet? While many might celebrate unexpected weight loss, it can sometimes be a red flag. We're not talking about shedding a pound or two. I'm referring to a significant, unexplained drop in weight.
This type of weight loss can be a sign your body is fighting something sinister behind the scenes. Cancers like those affecting the stomach, lungs, or pancreas can disrupt your metabolism and lead to unintended weight loss.
Don't brush off sudden weight loss as a win, especially if it's not related to changes in your lifestyle. It's always best to err on the side of caution and consult your doctor. Early detection is key when it comes to cancer, so stay vigilant and proactive. We all experience fatigue from time to time. A long day at work, a tough workout, or a poor night's sleep. But what if that exhaustion becomes a constant companion, a shadow that follows you no matter how much rest you get?
This persistent fatigue, the kind that disrupts your daily life and doesn't improve with sleep, can be a warning sign of something more serious. Cancers like leukemia, colon cancer, and stomach cancer can sap your body's energy reserves, leaving you feeling drained.
If you find yourself constantly exhausted, unable to shake off the feeling of utter depletion, don't ignore it. Talk to your doctor. They can assess your symptoms, run blood tests, and determine if there's an underlying cause for your fatigue. Taking charge of your health and seeking help when needed is a sign of strength, not weakness. We've all experienced the occasional cough or sore throat, especially during cold and flu season. But what happens when a cough lingers, refusing to loosen its grip on your lungs?
If you're dealing with a persistent cough that lasts for weeks, especially one accompanied by hoarseness, it's crucial to pay attention. A chronic cough, particularly one that doesn't resolve with over-the-counter remedies, can be a red flag for lung cancer or cancers affecting the throat.
Don't ignore a cough that just won't quit. If you're experiencing a persistent cough or hoarseness, especially if you're a smoker or have a history of smoking, consult your doctor. They can examine your throat, listen to your lungs, and determine if further investigation is necessary.
Our skin, the largest organ in our body, acts as a protective barrier against the outside world.
That's why it's crucial to pay close attention to any unusual or persistent changes in your skin. New moles, especially those that appear after the age of 40, should always be checked by a dermatologist.
Additionally, be on the lookout for changes in the size, shape, or color of existing moles. Any mole that becomes asymmetrical, has irregular borders, exhibits different colors within the same mole, or grows larger than a pencil eraser should be examined by a professional.
Skin sores that refuse to heal even after weeks or months can also be a warning sign of skin cancer. Regular self-exams and annual skin checks by a dermatologist are essential for catching any potential problems early on.
We all experience occasional digestive issues, constipation, diarrhea, or changes in bowel habits. But when these changes become persistent or unusual, it's important to pay attention.
Long-term constipation, especially if it's accompanied by abdominal pain or bloating, can be a sign of colon cancer. Similarly, chronic diarrhea or blood in the stool can also indicate a problem in the digestive tract, potentially signaling colon or rectal cancer. Changes in urinary habits, such as frequent urination, pain or burning during urination, or blood in the urine, should also raise a red flag. If you experience any persistent or concerning shifts in your bowel or bladder habits, consult your doctor. Swallowing, a seemingly simple act we often take for granted, involves a complex interplay of muscles and nerves. If you find yourself struggling to swallow, experiencing a sensation of food getting stuck in your throat, or having frequent choking episodes, it's essential to seek medical attention. Difficulty swallowing, also known as dysphagia, can be an early warning sign of cancers affecting the esophagus, throat, or stomach. These cancers can narrow the esophagus, making it difficult for food to pass through. If you experience persistent difficulties swallowing, don't ignore it. Consult your doctor for further examination. Our bodies are constantly changing, and while most lumps and bumps are harmless, some can signal a more serious underlying condition. It's crucial to be familiar with your body's normal landscape so you can quickly identify any unusual or persistent lumps or swelling. Pay close attention to areas like your breasts, testicles, and lymph nodes. Breast cancer often presents as a lump or thickening in the breast or underarm area. Testicular cancer typically appears as a lump or swelling in one of the testicles. If you notice any unusual lumps or swelling, especially if they are persistent, hard, or fixed in place, consult your doctor. Pain, often described as our body's alarm system, alerts us to injury or illness. While most pain is temporary and resolves with time or treatment, persistent or unusual pain should never be ignored. Similarly, unexplained bleeding, whether it's blood in the stool, urine, or from the uterus, can signal a serious underlying problem. Persistent pain, especially pain that is severe, wakes you up at night or doesn't respond to over-the-counter pain relievers, can be a warning sign of cancer. Unexplained bleeding, such as blood in the stool, blood in the urine, or vaginal bleeding after menopause, should always be evaluated by a healthcare professional. If you experience any persistent or unusual pain or bleeding, don't hesitate to consult your doctor. They can help determine the cause and recommend appropriate tests and treatment options. Your health is your most valuable asset, and knowledge is power when it comes to protecting it. We've covered 8 crucial cancer warning signs you should never ignore. If you experience any of these symptoms for an extended period, it's important to consult a healthcare professional for further examination. Early detection increases the chance of successful treatment in many cancers. Don't forget to like, subscribe, and hit the notification bell for more health tips and information. Your health is worth it.